Hi everyone, welcome to FTInsights. I'm Mike Fibus. An aging population and an already strained healthcare system, it's a combination that cries out for a fix. And increasingly, healthcare is looking at remote patient monitoring as the elixir, both to keep patients healthier and to keep costs down. Today, we're fortunate to have with us Eric Rock. He's founder and CEO of Vivify Health, one of the leading remote care providers. Eric, thank you so much for joining us.
Mike, thanks for having me on. Look forward to it.
So Eric, I was really heartened late last year when I saw CMS announce new CPT codes for remote patient monitoring. That should really loosen things up. I know when I talk to healthcare providers, they're all bought into remote patient monitoring. What they say is, who's going to pay for it? And increasingly, we're having the answer now, yes?
Without question, you know, what Vivify does in delivering care virtually, remotely, and monitoring combined with that is transformative without question. And so fortunately, our government is seeing the value in this and have brought new codes such as 99091 that started January 1st of this year. That's pretty significant. It clearly is geared towards the collection and interpretation of health data that's generated remotely. And it specifically carves out to assure that it's not just data being received, it requires that interactive approach, which is what Vivify is so very good at. And so the news here is that this particular code is not new, but it's now been unbundled. So it's no longer tied to the CPT codes that were more restrictive. So for example, you can now engage a patient, originate the patient in a home. They don't have to first come to the provider's office to be originated and brought into the program. You can quickly activate a broad population and get paid for it.
That's great. So are you more in post-acute or chronic condition care, nursing home care, some other? Where's the most traction?
Well, certainly we began in health systems where we have post-acute transitional care applied, but we've grown across numerous different organization types. Those that take risk certainly fit quite well, that are managing a Medicare Advantage population as an example, but also with our growing solution stack, including BYOD products, we fit squarely into the payer market as well. So we have some fast-growing payer customers. And certainly one of our investors, UPMC, fit that nicely with their near 4 million member health plan combined with their provider organization. It was a perfect incubator site for us to create these new solutions that carry, again, across all modalities from provider to payer and in between.
Yeah, I think that's a real opportunity with payers, because they really have an opportunity to exact change. You know, they've got a direct feed into not only your health, but how much you're paying.
Without question. They're obviously the risk bearer, and they're desiring to find ways to work together with the provider so that they can improve, of course, the overall outcomes, but reduce the costs. And they realize that they have to have the provider in the mix. So to have a solution, a platform in which they can collaborate together, for example, the payer providing analytics and guidance on the best pathways for a population, but the provider doing that final legwork that has various forms of reimbursement, and of course the payer's component to that. So working together, having technology stacks to allow them to do that is significant, and again, transformative for these relationships that we're starting to see between payer and provider.
Yeah, the payers are really in a unique position because they can sort of straddle that line between healthcare and wellness a whole lot better, a whole lot less restrictively than healthcare providers.
Yeah, and we're definitely seeing the payer getting closer to that edge of providing care. Right? So I think it's getting to the point with virtual solutions, they can deliver more and more of that, and to the clinical level. Of course, the larger payers have spun off their clinical delivery organizations, but even within the payer side of things, we are seeing growing call centers with nurses that are impacting the outcomes, the behaviors, social determinants, all those things that they can impact without touching the patient are becoming more and more valuable, and the tool set to accomplish that is here today.
Yeah, so the remote component is interesting. And, you know, when I think of remote patient providers, I think of much more local kinds of companies serving, you know, the community or regionally. But I mean, you're much bigger than that. Does the cloud help enable that, or is it a harbinger of what's to come?
Oh, without question, the cloud, of course, is an amorphous layer that's not restrained to any physical environment. And what that allows is not only for an expanse in geography, but an expanse in relationships. So multiple, again, organizations can work together in a value-based approach, payer, provider, and even those in between. We actually have capabilities in our platform that allow us to segregate data. So a payer may have responsibility for 10 million members, but they may have 150 different organizations that are supporting that each see their own population. And the payer, as an example, now has that umbrella approach to manage the population at whole while keeping data secure as needed across these multiple providers. The cloud is certainly a big deal without question, covering boundaries of geography as well as the payer-provider collaboration. And on geography, there's another consideration here. You know, we're starting to see some of those scenarios where state lines really bound the provider. We're starting to see some of those lines erased. For example, the recent announcement where the VA can now serve across state lines. I'm quite confident we're going to see some of this emerge on Capitol Hill for our providers in the traditional market as well.
Yeah, I mean, certainly just that is a big bang for efficiency to the healthcare system, to not have to limit it artificially like that.
Yeah, and there's another component too with the cloud and the ability actually for these providers to work from home. We know we've already overburdened these providers and these doctors are getting burnt out quite clearly here. So having those docs that may be nearing retirement, as an example, creates this pool of a provider community that can really take advantage of virtual care and these new reimbursement models and be employed by providers and payers in a way so that their time is spent on some of these reimbursements. You know, some of the, for example, chronic care management codes have now been extended to encompass those that are at higher risk. So with the introduction of, you know, the original 99490, bring in 99487 now for the high-risk population, more than doubles the return these providers can get. And with chronic care management, you can tie this with some of these other reimbursements. So again, we're stacking these reimbursements up in a way so that it's more of a time measurement, and having a perhaps lower paid retiree or near retiring provider could have a significant impact. So we're seeing and we're coaching our customers to apply their resources in this way. Think about who's at the back end of that could be most efficient from a fiscal perspective.
Yeah, and not just physicians, but all up and down, you know, the provider spectrum. You know, it's when I think you're probably too young, but when I was a kid and I went to the dentist cleaned my teeth, and he had a nurse handing him his tools. And now today, when you go, you've got hygienists that do that, and he or she is able to, instead of take care of one patient at a time, take care of 6 at a time. And I think in a way you're sort of enabling that kind of hierarchy of care and expanding it. Exactly
right. First, let me comment, I turned 52 in 2 months, by the way.
All right.
And second of all, we definitely enable efficient care delivery. We're putting intelligence to work here, where we're putting best practices in the protocols or pathways to apply to these patients. And then behind that, provide those providers with, if you will, recommendations on what are the best responses for these patients, and then automate as much as possible so that we can have the patient self-manage. So you're giving patients the education to self-manage. You put providers behind it, so there's brief interactions that are lower cost and total time, that the patient feels confident now that there's still somebody watching, and overall reducing those costs of care, but then also get virtual visits for the full intervention if needed, and often reimbursable as well. And lastly, and only in last resort, send them back to an actual physical location where the costs are the highest.
So HIMSS, the annual gathering of the health IT industry, is coming upon us just in another couple of weeks. Anything you're hoping to see?
I've been going to HIMSS for 25 years, and it never bores me. I'll tell you what, there's always something new. And we're certainly thrilled to be the position that we're in right now, because I'm quite confident that where Vivify sits is certainly the new era of healthcare delivery. And so we're thrilled to have space at the booth and partners at the event that we are going to highlight some incredible new technologies. We've continued to elaborate and build out our BYOD product, further lowering the overall cost for delivering virtual care plus remote monitoring on consumer devices. So having that ability to engage as we did with the more complex, higher cost kit now on your own phone allows for a much broader scale. And in addition to that, our product is very much content driven. So we're bringing more of those, I'll call it a form of wellness, but engagement to self-management content and pathways that allow for managing of a large population without providers at all behind it doing the monitoring. So that broad spectrum, you'll see a lot of this with Vivify at HIMSS. We're excited.
Okay, cool. You know, and actually that brings up a good point. We've spoken mostly about the business side of things, but let's say I'm a patient and either I've been identified with a chronic disease or I'm being let out of the hospital but still need care. Walk me through what do I get? What do I do?
Oh, you'll see some things in the future that I think are quite surprising. You might eventually see it in the consumer market and retail storefronts. I'll leave that for a later conversation. But today, patients are onboarded in one of two ways, primarily that post-discharge. You've had a significant event. You now fit the category of a high-risk patient that they need to make sure that you're staying healthy at home and avoiding that admission ED visit. That's the highest cost level. We've got 8 years of experience with this. The other angle is now to engage an entire population and to divide them out by their specific condition. Our product is multi-condition, whether you've got diabetes, COPD, heart failure, and everything in between, hypertension mixed in, we cover all of those. So you can now broadcast out to a large population, use it as an engagement tool, an analytics tool to discover what their needs are, including social determinants, but condition specific. So now broadcast out to the population to help manage it while retrieving information in real time to discover what are their real needs in care that may escalate and avoid that costly in-person care. And also on top of all that, virtual visits so that you can now have those intervention moments again to keep them out of the physical facility.
Yeah, it's an exciting time. There's a lot coming. I'm looking forward to seeing you at HIMSS. Eric, what can't you believe I didn't ask you?
You know, there's a buzz going around right now about a company called Amazon. Perhaps that might be a topic that everybody has of interest in. It's a brief topic. I'm sure by HIMSS we'll have a completely different picture on that. But I think everybody welcomes, you know, that consumer approach to delivering healthcare in a different way. And I think there really is not the depth of cutting out the middleman that they might think. The provider is absolutely critical. There will be relationships there. The payer is still going to be that aggregator of all of the services for the financial transaction. I certainly don't see, you know, Amazon taking that over. But they've got a large population between their partner organizations, and that's where they've stated they're going to start. In fact, in Forbes magazine just today, I noticed an article where they're backpedaling a bit on some of their partners because this is disrupting some of their own clients. Chase, for example, disrupting their own payer clients. So they're admitting, hey, this is only for our own employee population. But Vivify, for example, welcomes it. We're a software platform as we have new endpoints for collecting data, such as, you know, an Amazon Echo, as an example. Bring that on. That's just another mechanism to engage with an endpoint IoT type device that we're thrilled about. And lower the cost of some of these components in between, we think that it would be a welcome cause for healthcare.
Yeah. Yeah, I mean, when you really strip down the Amazon Echo, it's an ear and a mouth that, I mean, can only help, if you can work with it, can only help enhance the capabilities of the platform. So I would think that you're pretty flexible with that.
Yep, and there's television experiences and wearable experiences. All of those Vivify has certainly demonstrated capabilities with.
Yeah. Okay, great. Eric, I'm looking forward to seeing you in a few weeks at HIMSS. In the meantime, great to see you as always. Thanks for your insights and your time. Likewise, Mike. Thank you very much for having me. And thank you all for watching. Until next time, bye-bye.